Hello everyone. Today we have Dr. Debanjan Kundu with us, who is going to tell us about radiation oncology. So, welcome, sir.
Yeah. Hello, everyone. Hello, Dr. Ayush. So nice to be with you all here.
Thank you, sir. So, sir, we're going to start with a little bit of your introduction. Then we're going to go proceed for the radiation oncology part.
Yes, sure. As you all know, I am Dr. Debanjan Kundu. I am a clinical and radiation oncologist hailing from West Bengal. I did both my MBBS and MD from R.G.Kar Medical College and Hospital in Kolkata, and I have been working as a senior resident over there until recently. Over to you, Dr. Ayush.
Yes, sir. So, the first the basic question: is radiotherapy and radiation oncology the same thing, or is there any difference between them?
This is one thing that confuses many people. The old name of this branch is radiotherapy. However, before the National Medical Commission came into being, the board of directors in super session of MCI changed the name of this branch from radiotherapy to radiation oncology. Why? To better justify its curriculum, which involves total care of cancer patients. You have to remember that it's the only branch of oncology in which post graduation is possible right now, because all other branches are postdoctoral subjects. This branch involves diagnosing a cancer patient, prescribing investigations, and providing treatment. The treatment encompasses radiotherapy, all kinds of systemic therapy, supportive medicinal management, as well as palliative care.
Okay. So, sir, what do you do on regular basis in your department of radiation oncology?
Okay, this question is relevant for this branch only because all those people belonging to branches before the year 2022 would not have been exposed to the Department of Radiation Oncology during their MBBS period. So, duty structure will vary from institute to institute in residency, but mostly 1 to 2 days in a week you will be having oncology OPD. The remaining days would be divided between radiation planning, working in the departmental daycare center, giving chemotherapy and other systemic therapy, and also attending special clinics like site specific clinics, clinics for management of adverse effects of cancer treatment, palliative clinics. These may be available in your institute. Along with the special duties, you will have fundamental ones like everyday ward rounds. The first year junior residents in most institutes would have additional on call duty as well.
Okay.
Uh, Let me additionally paint a picture for you regarding radiation oncology OPD because you would not have any exposure to that as well. See, a particular cancer patient with any documentary proof of cancer, like a biopsy or a imaging investigation, which is highly suggestive of cancer, would come to a oncology OPD before commencement of their treatment. See, this practice is universal and prevalent throughout the world. So every day in your OPD, you would have patients, these new patients, who would need a total clinical evaluation with respect to their site of cancer. Post history tracking and clinical examination, the residents would go for initial staging, write up the necessary investigations, and also the tentative treatment plan on the first day itself. Okay. So in a busy OPD for a residence, it's quite natural in a oncology OPD to spend 15 to 20 minutes or even 20 to 30 minutes for a single patient. Apart from this, in an OPD, you will have follow-up patients whose treatments are already undergoing in your department. See, these patients would need clinical evaluation to further their treatment. Usually, a radiation oncology OPD is always a brainstorming one. You get exposed to all kinds of cancer from head to toe: breast, lung, head and neck cancers. These are the tip of the iceberg. And the others are lymphomas, CNS tumors,
Yes, sir.
gastrointestinal malignancies, bone tumors, soft tissue sarcoma, and there is no end to it. So there is no chance of getting bored per se.
Yeah. So, sir, there's a bit of perception between people that is there a threat of radiation exposure in this branch or not?
Yeah, I would say unequivocally no. Uh, See, radiation oncologists are involved in the radiation treatment plan. However, the actual treatment is automated and that is managed by machines and software. I
Yeah,
could say that an orthopedic surgeon or perhaps an interventional radiologist would be more exposed to radiation than radiation oncologist.
yeah. So, sir, what are the options MD and a post MD or a DNB pass out has in radiation oncology? What are the future aspects? Like post PG, what all options does he have?
Yeah. Uh, See, there is a number of ways one can go after their postgraduate. Number one would be to pursue DM or DRNB in medical oncology. For that, you have to sit for NEET SS or INSS. Number two would be to appear for FSC or clinical examination. This is something that will help you probably to get a better job in your country or elsewhere outside. The third option may be to sit for something called ESMO certification examination or specialty certificate examination that is again held in UK. But uh, if you go to the NMC website, you'd see that there is a fourth option as well. There are some super specialty courses which is available in core radiotherapy as well. There is a 6 years course in radiotherapy and oncology which is approved in AMS Jodhpur with an annual intake of 2 seats. There are two sub-site specific DM radiotherapy courses as well. If I correctly remember, one is in genitourinary, other is in gynecological malignancies, and these are there in AIMS Rishikesh with annual intake of 4 each. However, I would provide a disclaimer here. If you really intend to take up these branches, please personally talk with the people who are pursuing this. Okay, please remember that.
Yeah. So, sir, what's the difference between that 6 year course and is it a quite different between doing a 6 year course or doing a super specialty after this after our radiation oncology?
Okay, yeah, you have to remember that pursuing medical oncology is quite different from what we are doing in radiation oncology per se. It is something like doing doing DM in cardiology after doing MD in pulmonary medicine or respiratory medicine. So, what you are basically doing is a branch change.
Yeah.
After doing DM in medical oncology, no one probably practices the radiation oncology part in private or government sector. That is the current scenario as of now. So you must remember that and you have to take cognizance of where actually your interests lie.
Okay. So one other thing that I have heard is like whenever uh, post radiation oncologist goes for a DM medical oncology course. So, and one guy who is doing is has done medicine post graduation. So it will be easier for him to manage a case because he has read all the medicine. He knows about all the complications. So will it be a quite difficult for a post radiation oncology guy to like manage the patients in medical oncology, or does he
Okay.
get through with all these things with time?
Uh, okay. Yeah. I would say that there are two aspects to this super specialty situation right now. Okay, with radiation oncology. Number one, I would say, is the eligibility. Since last 2 years, what has happened is this issue has grown beyond academics, unfortunately. Each
Okay.
year, there has been a court case or so, and after which NMC has retained the eligibility of radiation oncologists so far. Because logically, you see, we are the only oncologists at MD level. So it makes no sense to exclude us from a super specialty of oncology per se. But honestly speaking, no one can really say what may happen in future. I do hope that radiation oncologists all over India won't stop fighting for it. And coming to the second aspect, which may be more important, is the NEET SS examination itself. You'd know that since last year there has been a landmark change in the syllabus of this exam. So as of now, for medical oncology super specialty, the entire question paper will be from medicine. So yes, as of now, one has to read medicine entirely to sit for this exam.
Okay.
That is the fact.
Okay. So you told us about FRCR. So what other, including FRCR, what are the other options we have for settling in foreign countries
Yeah,
after radiation oncology?
yeah. If you take a stock of the market situation, you'd see a lot of radiation oncologists practicing in foreign countries. Okay. So you need to get into registration pathways in order to practice in different countries. Like FRCR in clinical oncology can help you get the General Medical Council registration in UK. There is something called RANZCR, which is required for practicing in Australia and New Zealand. Apart from this, Canada is one of the options to settle in because of it having one of the state-of-the-art radiotherapy centers like Princess Margaret. Moreover, I must say that Gulf countries are also a good options to practice for a radiation oncologist, and FRCR in this regard can also help you to some extent.
Okay. So, sir, what's the status of jobs just after radiation oncology? What's the status in public sector, private sector, government sector, and private sector? And secondly, is there a difference in tier one, tier two cities? What's the status of jobs after PG?
Yeah, at the outset, I can say that in radiation or medical oncology, uh, in a private hospital, the initial post of registrar will be at par with respect to salary with any other branch. Okay. In West Bengal, the starting salary in different centers usually varies between an annual cost to company of 9.5 to 14 lakhs per se.
Okay.
Later on, as a consultant, however, what you will learn will depend on your practice, as is the case for every branch, and the practice will vary with respect to what you are doing actually, like clinical oncology consultations and or chemotherapy and or radiotherapy practice. And it will also depend on where you are practicing as well, tier 1, tier 2, or tier 3 cities. Earning at some point mostly will depend on how many hours you can devote actually to your branch. You must remember that there is always a talk of saturation in this branch. I would not say that saturation is not there per se, but this is a very subjective concept. Jobs are there if you really want to go for it. You just have to look for it hard enough, and you have to ready to adapt to the situation at place, be it a tier 1 or tier 2 or tier 3 city. And I would like to say that as of now, more and more new centers of radiation oncology is coming up in India, and that's applicable for everywhere.
So our tier three or tier three cities are also having the jobs because what I heard with so many people that is that most of these radiation oncology jobs are just concentrated in tier one and tier two cities. So
Yeah,
is this so,
I
or is this just a misconception we have?
I would say that as of now, most of the institutes are indeed in tier 1 or tier 2 cities, at least in West Bengal. However, the situation is not the same elsewhere in the country. Man. For example, states like Maharashtra or Union territory like Delhi has so many centers concentrated even on the outskirts of the city. Okay. And in West Bengal also, I would say centers are indeed coming up in tier 3 cities in the near future.
Okay. So what while doing the PG, what is the academic load? How much is the academic load? What all we have to study and all? Because that's one of the things people think before taking a
Yeah.
branch.
Yes. It's interesting because this is one of the branches where academics indeed hold a very important place right from the start. You see, as this is a fast growing subject, you will see improvements and changes in treatment options as often as maybe every month, if not more. Regular presentations, symposiums, seminars, journal clubs, quizzes are held by different associations and different institutions throughout the country. Residents indeed should try to attend those. The syllabus is huge, and there is something called medical physics, which you have to learn from scratch. And so you have to get ready for academic roller coaster, as I like to say. Yeah.
Yes, yeah. So, sir, well, one of the biggest, or like this debate is quite relevant nowadays, MD or DNB. Because what I have heard is DNB institutes are have better facilities available in terms of radiation oncology, like they have better machines and all. So, is it the case? What do you think of them?
Okay. Yeah. MD radiation oncology, you see, is mostly run by medical colleges. Most of them are government run, while DNB is mostly run by private hospital. See,
Mm.
as far as academics is concerned, many medical colleges, I guess, I think, would be superior to most DNB institutes. However, there are exceptions in West Bengal as well. DNB institutes, though, as you have rightly said, may in some cases boast of cutting edge machines and equipments in radiation oncology. More and more DNB centers are coming up with new equipments which are not there in many government hospitals, especially the peripheral ones. Okay, there is another catch. Some DNB residents may not get exposed to chemotherapy or systemic therapy per se, as most DNB institutes would have a separate medical oncology department to cater to that aspect, which is
Yeah,
not the case in government hospitals or medical colleges.
yeah,
They
yeah.
mostly, till now, do not have a separate medical oncology department. So, radiation oncologists do practice as a clinical oncologist in those government hospitals. But in DNB institutes, again, they might have access to some drugs or investigations which those medical colleges do not have. So it's basically a balance between pros and cons. Uh, let's see.
Okay. Yeah. So if I'm a person who want to take a radiation oncology, how should I go for to between choosing the colleges and all? What point should I consider before choosing a college?
Yeah. So to get that balance between pros and cons, you have to go for thorough research.
Yeah.
And research means you have to talk to radiation oncology residents to know about the tidbits of every institute, and do not go by hearsay. Go to the institute if it is possible for you and see the departments for yourself. See, the radiation department of an institutions would have medical linear accelerators, plus minus telecobalt machines, and or HDR brachytherapy units, or any combination of these. In addition, it may have departmental daycare facilities and those special clinics that I have earlier mentioned. So you need to look for those as well.
Okay. So, sir, do you have that? If if you can provide us some list, we'll put in the comment section if all the top medical colleges or DNB centers that we'll do in the comment section.
Yes,
So
yes, sure.
So how should I know that I have that aptitude for I have that interest or aptitude? How should I know, or one should decide that one can develop interest in radiotherapy or not? So
Yes,
that's one.
yes, yes. Again, this question is only relevant because most MBBS students are not exposed to this branch during their curriculum. But I have a good procedure for this. Ask yourself three questions. Okay. Number A, do you like medicine? That is to clinically evaluate, investigate, and treat a patient. Do you have a penchant for diagnostic radiology per se, like Dr. Ayush? Do you love reading CT scan, MRIs, and interpreting them yourself without the help of a radiologist? And thirdly, do you love handling computers, operating and learning? new softwares, and cutting edge programs. So, see, if the answers to all these three questions are yes, then I would say that you really uh, have an inclination for a branch like radiation oncology. This is
Okay.
what I did when I wanted to go for this branch. Yes.
Yes. So, sir, one more thing, that is it a fully hospital dependent branch, or we can just, in some cases, we can put our own clinics, or is it just a hospital dependent branch only?
See, it does have its nuances. You can have your own clinic and practice clinical oncology. No one is stopping you per se. It will involve preventing oncology as well as diagnosing and investigating a case, following, uh, followed by following up those patients. Chemotherapy can be administered in hospitals or nursing home, preferably with an ICU support per se. As I have alluded to before, many systemic therapy administrations are outpatient procedures, so they don't perhaps necessitate hospital admissions in all cases. However, as you were saying, the instruments and system used for delivery of radiotherapy are expensive. So
Yes.
as of now, it is difficult for you to own one. So you have to have an attachment for that, the radiotherapy practice.
Okay. So we are going at the end of this these things. So what do you think that future of this branch is? What recent or future advances we can look forward to it, and future expects?
Yes, as I was saying before, this branch is probably the fastest growing branch among all others right now. The absolute number of cancer cases is rising and will keep on rising throughout the world as per current trend. Firstly, one has to remember is that aspects of diagnostic and therapeutics are very fluid in oncology and it necessitates frequent updation. Okay, I will give you examples. Something called conventional radiotherapy used to be the principal treatment modality of radiation provided to the state of West Bengal even 5 to 6 years back in most institutes. However, now the fraternity is talking about high precision radiotherapy like volumetric modulated arc therapy or stereotactic ablative radiation with adaptation applicable for individual patients. Secondly, 5 years back, just 5 years back, there were no medical linear accelerators in West Bengal, at least in the government sector, to the best of my knowledge. Fast forward to now, we have at least five government facilities and numerous private facilities here with Linux. So you can appreciate how rapidly this branch is growing, not only in West Bengal, but commensurately all over in India and throughout the world. And the industry supporting the branch is also growing. Do remember that.
Yes. So, sir, I think this is we come to end of this our interview or this conversation.
Yeah.
So, what I think that branches like radiation oncologies and all the branches I covered before, these because people might have interest in them, but they just are not able to take it because they don't have that knowledge. So, thank you, sir, for giving us all this knowledge, and I think many people will get benefit from this, and many will take end up taking radiation oncology.
Yeah, I will tell you something. I will take how did I end up in taking this branch. Okay.
Yeah, yeah,
The
yeah, sure.
introduction to this branch actually happened through one of my batchmates, okay, who actually had taken up this branch in an earlier year. However, you have to remember that the research into this branch for me actually started 1 year back from the time when I actually took it. So in that
Okay,
single year, you guys won't believe that I actually ended up contacting radiation oncology residents and consultants throughout India during
okay,
that year, literally from Kashmir to Kanyakumari. Okay.
okay,
And to my utter relief, people were extremely helpful. many had encouraged my interest into the branch, and I received a lot of workable information from it. Thankfully, like I told you to do before, I had the good opportunity to visit some radiation oncology departments myself as well, and the work profile or the job profile, the daily job profile, I would say, looked very interesting to me. So when finally the results of NEET PG came out that year, I was very happy that I knew that I could get into radiation oncology in a good institute. So that's how it happened with me.
Okay, that's a really nice story, sir.
Yeah.
So, well, I'd like to end up this conversation. Thank you again, sir, for coming. And okay,
Thank you, Dr. Vash. It was
okay, sir.
lovely to meet you all. Good
Thank you,
night.
sir. Good night.